So this video is going to be the examination flow for the nose, mouth, and oropharynx. First, we will start off with the nose. I will be looking at my patient's exterior nose, looking for any asymmetries or deformities. Next, I would have gloves on, but again, we don't have gloves. I will be taking the tip of my hand and compressing the tip of his nose. It will have you lean back a little bit. I do have my short, wide speculum scope to look inside his nose. I will be lean back, please, and I will be observing inside here. Excuse me. Bam. And then I'll be looking for. Well, I'll look at both nostrils first. Then I'll explain what I'm looking for. Nice. I can see a lot more this time. All right, there we go. So, what I will be observing for when I am looking inside the nose is I'll be looking at the nasal mucosa, nasal septum, as well as the middle and inferior turbinates. I will be looking for any redness, swelling, polyps, deviation, or exudates. Then I will be testing the, what's that word? Patency test. I'll be testing for patency, nasal patency. So could you block one nose, please? Breathe in and out. And then to the outside. Beautiful. There we go. So we're just testing for asymmetries in that regard. Then I will be palpating, percussing your frontal sinus and maxillary sinus. Is that okay?
Mm-hmm.
All right. So I will be. Any tenderness here?
No.
No. What about now?
Mm-mm.
No. Okay. So now I'm going to do the maxillary. So again, any tenderness here?
No.
What about now?
Mm-mm.
No? Okay. And that is for the nasal exam flow, or nose exam flow. Next, I will be doing the mouth and oropharynx. I will be observing the exterior part of his lips, looking for any redness, discoloration, cracking, dryness, wetness, any ulcers or sores. Then I will be taking my tongue depressor, and I will be looking at the inside of his mouth. So could you open up your mouth? I'll be looking at the buccal mucosa. I would have a pen light, but I don't actually have a pen light on me. I have to go to the bookstore and buy one of those. So I will be looking at the buccal mucosa on the side of his mouth, looking for any bite marks or pigmentation, any ulcers on both sides. Then I will be looking at his gums. So could you down here? At his gums, looking for any swelling or discoloration. Then I'll be looking at his teeth, again looking at the color or the quality of the surface. Then I'll be looking at the top of his tongue. Stick your tongue out. Yeah, there we go. Looking for, again, the texture of it, the size, the color. And could you lift your tongue, please? Lift your tongue so I can look inside you. Now I'm looking at the floor of his tongue, looking at the salivary glands, looking for any ulcers, any polyps, and looking how much saliva is down there. Then I'll be looking at the side of his tongue. So I'll be moving your tongue. I don't have any of those gauze pads to bring his tongue off to the side. So could you scooch it a little bit? There we go. And I'm gonna be looking at the side of your tongue. Okay, again, looking for any discoloration, any polyps, any ulcers or anything like that. There we go. Done with this. Next, I will be checking the soft palate. I'm gonna use the light on my speculum over here. So I'll be checking the hard palate. Could you look up for me and open your mouth? All right, there we go. Again, the hard palate. I'm looking for structure. I'm looking for any formation, deformities, and color. And then I will be taking my tongue depressor again, actually, and I will be. Can you stick your tongue out? And I'm gonna ask you to say ah. All right, and as he's do that again, please. Okay, as he's doing that, I am seeing the uvula and soft palate elevate together, and I'm looking for any redness or exudates on the tonsils or the posterior oropharynx. After I do that, let's see, we're doing so good so far. Let's see. After we do that, I will be checking for, so we did the, then I'll be testing for the gag reflex, everybody's favorite. I will be taking my tongue depressor and I will be running it across the posterior aspect of his oropharynx. All right, could you open up your mouth And there we go. We're observing for elevation of the uvula and soft palate together. Next, I will be checking for hypoglossal nerve, which so the test previously was for glossopharyngeal and the vagus nerve. Next, I'll be testing for hypoglossal nerve, which is the tongue. You just stick your tongue out, and we're looking for any deviation of the tongue. And I think that's it. Good job, sir. There we go.